Drug schedules and drug schedule charts are essential tools used in medicine to categorize various types of drugs based on their potential for abuse and addiction. Essentially, drug schedules are a classification system developed by the United States government that ranks drugs based on their medical value and potential for misuse or abuse. The schedules range from Schedule 1 to Schedule 5, with Schedule 1 drugs being considered the most dangerous and Schedule 5 drugs having the lowest potential for abuse. Drug schedule charts are visual aids that display this classification system in an easy-to-understand format. They provide information about each drug and the corresponding schedule it falls under. These charts are used by healthcare professionals, law enforcement agencies, and patients to understand the risks and benefits associated with different drugs. They can be used to identify controlled substances, help prevent prescription drug abuse, and ensure proper prescribing practices. Managing medications effectively is a critical aspect of maintaining one's health, especially when dealing with multiple prescriptions, complex regimens, or changes in dosage or instructions. Drug schedule templates can be an invaluable tool for individuals, caregivers, and healthcare professionals in ensuring that medication are taken correctly, on time, and with the appropriate precautions. To use our free drug schedule chart, follow these steps. Download our drug schedule chart from the Carepatron platform, which you can find in the link in the description. First, fill in the patient information. Start by filling in the patient information section. Enter the patient's name, date of birth, doctor's name, contact information, and any known allergies. Next, review the comprehensive drug schedule chart. Familiarize yourself with the different drug classifications and examples. This can help you better understand the medications you're taking or have been prescribed. Next, list your medications. Under the medication schedule section, you'll find a table with columns for time, medication name, dosage, instructions, and additional notes. Next, fill in the dosages. In the dosage column, write down the specific dosage for each medication. Next, write the instructions. In the instructions column, write down any specific directions for taking each medication. This may include whether the drug should be taken with or without food. Next, add additional notes. In the additional notes column, you can provide any extra information about the medication or its purpose. Lastly, keep the chart accessible. Place the completed drug schedule chart in a location where you can easily see it every day, such as on your refrigerator, bathroom mirror, or next to your bed. Here is a sample of our drug schedule chart, which you can find on our Carepatron platform. To find our drug schedule chart, go to our Carepatron platform or click on the link in the description. In our template section, we have a variety of templates and worksheets for you to use with your patients. You can filter or type in the keywords to find the worksheet. For watching our video at Carepatron. If you enjoyed this video, give us a like. If you would like to see more videos like these, subscribe to our Carepatron channel or click on one of our recommended videos.